still support an extension?
And we have worked to make sure, especially more children are covered, folks, and to do things to take down barriers to make sure more things are covered. I think that on the Medicaid piece of the ACA, what we want is the best fit for Missouri, and any change in our Medicaid laws is clearly going to require legislation. So I'm going to work with the legislature and everyone around the table to find the best fit for our state. I mean, this is you're dealing with hundreds of thousands of lives. You're dealing with billions of dollars, and I certainly appreciate people having the ability to make quick reactions and quick statements and whatnot. But these are some and certainly not saying I support everything that's in a bill or that sort of stuff. But the bottom line is that in order to get movement forward, it's going to require stakeholders, legislators, and others to come together. And so I'm trying to listen and to work with folks for what's best for the healthcare of Missouri and best for the financial health of our state, and protect the sovereignty of the state of Missouri and our particular powers that we have in these areas. And there are a myriad of issues involved in that, and it is not as and so we are beginning a process to define on a number of these issues what's the best fit for our state. And I will work with, as I said before, the legislature, other stakeholders, hospitals, others, to make sure that we craft the best fit for the state.
Governor, does that mean during the campaign you're not going to say whether you do favor or don't favor this if it's an all-or-nothing expansion? You said in your voice state address, you said those coverage decisions were best made at the state level. This would expand into working age, childless adults, which is not going to subject to your expansion. What is your position on whether it should be expanded, regardless of whether you can get that through the legislature?
Well, I mean, we're going to work with folks to analyze all of this. I mean, clearly there is huge numbers of uncertainties out there. There are countless rules and regulations at the federal level. There are any number of corners here, but I've stated that, and we'll continue to work to what's best for the best health of the folks of our state, to access and use taxpayer dollars efficiently and effectively, and certainly we'll work to keep the sovereignty of the state. But yeah, I mean, I'm not saying it's really easy to just say yes and no and to say and to start this this kind of this banter back and forth that Washington has become so famous for. And quite frankly, I'm not going to do that. I'm going to work with folks, and whatever gets done is going to require all of us coming together and getting that done next year anyway. I mean, certainly, if I didn't want to work on it, if I didn't want to try to make the healthcare system of our state better, if I didn't want to make sure the Missouri taxpayers dollars were spent effectively, if I didn't want to make sure that we kept our sovereignty and kept control where we could in the state, I could simply say yes or no and walk away from this. But people didn't elect me governor to do that. They elected me governor to try to take the tools, and these are new tools which are haven't been well defined yet, and there are hundreds of issues here. But we'll work to get the best fit for our state. We'll work to use taxpayer resources effectively, and I'll work to make sure we keep state sovereignty.
At this point, do you think the state can afford $100 million a year ultimately for us?
I mean, without getting into detail on something there haven't even been rules and regulations started with yet, I mean, I think everybody is aware of the lack of match necessary on the front end of many of these programs, and the resources available, the tax.